Good evening, students. Before going to the topic proper, remember this slide, and this slide will be explained at the end of the class. Okay, today we are going to discuss about diphtheria, pertussis and tetanus. These are all three important diseases which are prevented by vaccine preventable diseases. They are deadly diseases which can be easily prevented by giving vaccination. So diphtheria, what is the meaning of diphtheria? Diphtheros means leather. It's a leather-like membrane which is produced by Corynebacterium diphtheriae, so it's called as diphtheria. The name is, the bacteria is called as Klebsiella bacillus because it was discovered by Klebsiella, two scientists from German. There are four types of diphtheria: facial diphtheria, laryngeal, nasal diphtheria and cutaneous diphtheria. Facial means it involves tonsil and oropharynx. This is called as facial. It's not facial, it's facial. And laryngeal diphtheria involves the larynx, and nasal diphtheria involves the nares only. This is a mild form of diphtheria, and cutaneous diphtheria also a mild form of diphtheria. Both facial and laryngeal diphtheria are the severest form of the diphtheria, which can lead to death and other complications of diphtheria. So this is a facial diphtheria. You can easily see the membrane. This is whitish gray in color. This membrane cannot be removed from the surface. It can bleed on touch. The toxin is an exotoxin by Corynebacterium diphtheria, which can be easily absorbed into the bloodstream, which in turn kills the cells of heart, kidney and nerve cells because it can block the protein synthesis. Diphtheria has got a short incubation period starting from 3 days onwards. Laryngeal diphtheria, it's a severe form of diphtheria. It can produce symptoms and signs of bull neck with barking cough and croup. You can easily remember by the terminology BBC. B for bull neck, barking cough and croup. This is the bull neck of diphtheria. You can easily diagnose the bull neck. Membrane. The membrane is whitish gray in color. It's firmly attached to the underlying mucosa or the tonsil anterior pilus. So it's very difficult to remove the membrane. If you try to remove the membrane, you may dislodge it and you can spread the toxins. So whenever you are trying to take swab from the membrane, you should be careful enough not to disturb the membrane. So the croup severity. This is a scoring system called Wesley's scoring system, which can be used to classify the croup severity. So there are 5 parameters: chest wall retraction, stridor, cyanosis, level of consciousness and air entry, and 5 marks. So chest wall retraction from 0 to 3. 0 means none, 1 is mild, 2 moderate and 3 severe. Stridor with agitation 1. At rest, if the stridor is present even at rest, its score is 2. And cyanosis with agitation is 4. Cyanosis present at rest is 5. And level of consciousness, if the child is disoriented, then score will be 5. Air entry decreased means score is 1, and markedly decreased means score is 2. So a total score of less than 2 indicates mild croup. The child will have barking cough and hoarseness, but there will not be any stridor at rest. Total score of 3 to 5 is moderate croup. Easily heard stridor will be there, but with a few other signs only. And score of 6 to 11 is severe croup. Obvious stridor will be there, then other features of chest wall indrawing will be there. More than 12 indicates impending respiratory failure. The child may need intubation or child may need tracheostomy. The barking cough and stridor may no longer prominent at this stage. At this stage, child may not be able to cough and stridor may not be present, but the respiratory failure will be more. You should be careful while dealing the child with a score more than 12. You should be ready with the intubation and mechanical ventilation. Treatment. What is the treatment? Specific treatment will be ADS, that is antidiphtheritic serum. Antidiphtheritic serum should be given as early as possible. You should not wait for the biological confirmation or laboratory confirmation. You can diagnose by clinical methods. Diphtheria can be diagnosed by clinical methods and you should start the ADS. The units varies from 20 to 1 lakh units. So 20 to 40,000 units for anterior laryngeal or pharyngeal diphtheria of 48 hours or less duration, and 40 to 60 for nasopharyngeal diphtheria, and 60 to 100 in case of extensive disease of over 3 days duration or with neck edema. ADS should be initiated as early as possible to prevent the complications of diphtheria. Also, we have to eradicate the bacteria in the circulation, in the throat, in the tonsillar bed. So, treatment will be metronidazole, erythromycin and penicillin. Erythromycin is given either orally or by injection for the duration of 14 days, 40 mg per kg per day with a maximum of 2 gram per day. Then procaine penicillin is given intramuscularly for 14 days. Patient with allergy to penicillin G or erythromycin can be treated with rifampicin or clindamycin. Prognosis: 50% of child will die if left untreated or treated very late, and even with treatment, case fatality rate is 5%. So, one of the leading cause of death is myocarditis, diphtheritic myocarditis. Prevention. So, vaccine is easily available. It's a killed vaccine. It's a safe vaccine. It can be given from 6 weeks, 10 weeks, 14 weeks, 3 doses. Then booster dose given at 1.5 years and 5 years of age. So next we are going to discuss about pertussis. This is also very important. Pertussis is otherwise known as whooping cough. It's highly contagious respiratory disease. It is caused by the bacterium Bordetella pertussis. It is otherwise called as 100-day cough because it will produce cough which can last longer, more than 100 days. Pertussis will produce uncontrollable violent coughing. Even child feel it very difficult to breathe. During the cough fits, someone with pertussis often needs to take deep breath, which result in whooping sound. That's why it's called as whooping cough. Pertussis will affect all ages, but infants are more vulnerable. There are 3 stages in pertussis. Early stage is catarrhal stage. It will last for 1 to 2 weeks. It will have only runny nose, low grade fever, mild cough. And in newborn or in the infancy, child will have apneic episodes, that is pause in between the breathing. So in the early stages, it mimics a common cold. So it's very difficult to diagnose during the early stage of catarrhal stage. Then it will progress to the stage of paroxysm. After 1 to 2 weeks, and as disease progresses, the typical symptoms of pertussis may appear. That includes paroxysm, that fits of many rapid coughs, followed by high-pitched whoop, then vomiting after cough and exhaustion. So 3 parts are very important. First, paroxysm of cough, vomiting and exhaustion. This will happen during the later stage of paroxysm. Pertussis can cause violent and rapid coughing over and over. So until the air is gone out of the lungs, where there is no more air in the lungs, you are forced to inhale with a loud whooping sound. The extreme coughing can cause you to throw up and child will be very tired. Although you are often exhausted after a coughing fit, they will appear fairly well in between. In between the cough episode, child may be looking normal, but during cough episode, the child will be very much disturbed and tired. So the cough fits can longer up to 10 weeks or more. In China, pertussis is known as 100-day cough. It can last up to 10 weeks also. So this is progression. Stage 1 is catalyst stage. It will last 1 to 2 weeks. Symptoms will be like a common cold, runny nose, low-grade fever, mild and occasional cough. It's highly contagious. This stage is highly contagious and we may not recognize the stage, so it can spread the disease rapidly to the unimmunized persons. And second stage, you will have the typical rapid cough with vomiting and exhaustion. Triad. It's a triad paroxysm. Triad will have a rapid cough and vomiting and exhaustion. Then as the disease progresses, they may develop antibodies. Then comes the convalescent stage. During the stage, recovery is gradual and cough lessens, but cough may persist for 100 days. So there are 3 stages: catalyst stage, paroxysmal stage and convalescent stage. Next come very important topic is tetanus. Tetanus, as you know, it's caused by Clostridium tetani. It has got a wide range of incubation period, 3 to 14 days. And there are 3 common types of tetanus, that is localized, generalized and cephalic. Localized tetanus will produce pain, constant rigidity and muscle spasm in the region of the injury. Sometimes some area may be injured and local tetanus spores can invade and will produce localized tetanus. Generalized tetanus is sudden onset with muscle spasm. It will affect the back and abdomen. Newborn babies will develop refusal of feeds, that is neonatal tetanus. Opisthotonus will be a common finding, that is arching backwards with retraction of head and clenching of jaw and hands. This is the typical opisthotonus posture. And cephalic tetanus, this is also very rare entity. Like localized tetanus, cephalic tetanus also a very rare entity. It will affect the cranial nerves, 1 or 2 cranial nerves, paresis and paralysis of cranial nerves, most commonly 7th cranial nerve. Initially confined to head and neck, later it can progress to involve the rest of the body. So there are 3 types of tetanus: localized and generalized and cephalic tetanus. Complications: it can affect respiratory muscles, so aspiration pneumonia, atelectasis, mediastinal emphysema and pneumothorax are common. Tetanic seizures that can produce laceration of tongue, buccal mucosa and intramuscular hematoma. Vertebral fracture also common during tetanic seizure. Due to autonomic instability, arrhythmia, myocarditis and hypotension can occur with the tetanus. The typical opisthotonus in the newborn period or neonatal period. Treatment: specific treatment is with the anti-tetanus serum, 1 lakh international unit to children, 30 to 50,000 international unit to newborns. So active immunization should be followed with the passive immunization with the tetanus toxide. Sedation is very important in case of treatment of tetanus, because they will be agitated by sound, light. So you should isolate the child in a calm, dark room. You should not disturb them with the sound and light. That is very important. Each stimulus will produce the tetanic spasm and tetanic convulsions. It can worsen the condition. So maintaining a calm and dark room is very important. and supportive treatment is also very important. Prophylaxis is active immunization with DPT and DT. Passive immunization is with anti-tetanus serum. Prognosis is neonatal tetanus may end up with cerebral palsy. As you know, any insult in the growing brain up to 2 years can lead to cerebral palsy. So if the baby develops neonatal tetanus, frequent hypoxic episodes and convulsions can lead to CP. Mental retardation, behavior problems can be due to anoxia and apnea due to the spasm. The disease per se will not produce the CP and other complications. The disease produces hypoxia and anoxia and hypoxia produce a lot of problems in the baby. Survivor from neonatal tetanus still needs active immunization since tetanus doesn't confer immunity against future disease. So while giving passive immunization with the ATS anti-tetanus serum, we should give tetanus toxoid also. One important finding is the child will be conscious even though the child is having spasm or seizure-like episodes. Child will remain conscious. So child can see everything, child can hear everything, child can observe everything. That is a very important point to differentiate between convulsions and tetanus spasms. During convulsion, child may not recognize the word, child will not hear, child will not recognize the treating persons. But in tetanus, even though the child is having spasm and tetanic seizure, child will see you, child can hear you, child can understand what we are talking about, just like rabies. So India celebrates a maternal and neonatal tetanus elimination. We have eliminated, not eradicated, we have just eliminated the maternal and neonatal tetanus. This was celebrated in 14 July 2016. So that is the reason for my first slide. Congrats India. So India is the first country to be officially acknowledged as being yaws free. Yaws is one of the spirochetes disease. Yaws, free from yaws, and India also validated the MNT, that is maternal and neonatal tetanus elimination, in April 2015, much ahead of the global target date of December 2015. So it's been since 5 years we have eliminated maternal and neonatal tetanus elimination through immunization and clean delivery practices. Thank you. Good evening, students. Before going to the topic